Introduction. Sarah sat in her living room, surrounded by piles of paper, feeling completely overwhelmed. It was November in Michigan and the wind howled outside her window, adding to her feelings of confusion and frustration. As Sarah approached her 65th birthday, she found herself bombarded with advertisements, mailers, and phone calls about Medicare. Although she knew it was something she needed to understand, she couldn't help but feel overwhelmed by the plethora of information and options available. Sarah had always been an independent woman, able to handle anything that came her way. But this was different. She felt lost and unsure about how to proceed. She didn't want to make any mistakes that could cost her down the line. Does this sound familiar? Before we embark on this journey, it's important to adopt a growth mindset, as espoused by Professor Carol Dweck. A growth mindset is the belief that challenges are opportunities for growth, and failure is a stepping stone to success. With this mindset, we approach the Medicare enrollment process as an opportunity to learn, grow, and take ownership of our healthcare decisions. It's an opportunity to explore the benefits that the program offers and make informed choices that work best for our individual needs. Sarah didn't have to face this challenge alone. There were resources available to help her navigate the Medicare system and understand her options. All she needed to do was take a deep breath and reach out for help. This scenario plays out across America daily. Some people feel like they are entering into a maze with no clear way out. The purpose of this guide is to help make it easier for you. We will explain Medicare in easy-to-understand terminology. But as easy as we try to make it, we understand that Medicare is not an easy topic. As a result, we want to give you a gift. If ever you start to feel overwhelmed, stop listening and schedule your free consultation. You can call 313-472-5347 or email Janine at lifestylesafety.com or visit our website www.lifestylesafety.com/contact to schedule. Our goal is to make the process easy for you. We like to say, you can explore on your own, but never alone. We are here to help you throughout your entire Medicare journey. There are 5 chapters, which include the basics, enrolling, Medicare Advantage versus Supplement, special need plans, and final thoughts. I understand that some people just want the main point, while others want the details. As a result, each chapter will include the main point, the details, and a bonus tip to help you get the information you need the way you want it. Chapter 1: The Basics. Main point. Parts of Medicare. Part A: Hospitalization. Part B: Medical. Part C: Medicare Advantage. Part D: Prescription drugs. Who administers Parts A and B: Centers for Medicare and Medicaid Services. C and D: Private companies. Original Medicare has deductibles, co-pays, co-insurance, and no out-of-pocket maximum. Bonus tip. Many choose a supplement or advantage plan to ensure they have protection from unexpected medical expenses. Sarah realized that she needed a plan, a step-by-step guide to help her navigate Medicare. She began by scheduling an appointment with a lifestyle safety advisor. The advisor explained the different parts of Medicare, including Part A, Part B, Part C, and Part D. This information helped Sarah understand the benefits and costs associated with each part. Here's what she learned. The Medicare program is federal health insurance for people who are 65 or older, certain younger people with disabilities, and people with end-stage renal disease. It has 4 parts. Part A, Part B, Part C, and Part D. Part A covers hospital stays, skilled nursing, and some home health services. Part B covers doctor visits, outpatient services, preventive screenings, and durable medical equipment. Part C or Medicare Advantage plans are offered by private insurance companies and provide coverage like Parts A, B, and D, along with additional benefits like vision, dental, hearing, and many more. Part D is for prescription drug coverage offered by private insurance companies. You can enroll in Part D separately or through a Medicare Advantage plan. What are the costs for Medicare? Medicare Part A is considered hospital insurance and covers inpatient hospital stays, skilled nursing facility care, hospice care, and home health care services. In most cases, if you or your spouse paid Medicare taxes while working for at least 10 years, you are eligible for premium-free Medicare Part A coverage. If you have not paid adequately into the system, then your premium will be dependent upon how many quarters you paid. While there is no Part A premium for most people, there are other costs to consider, such as deductibles and co-pays. A deductible is the amount you must pay before your insurance coverage pays. With Medicare Part A, the deductible for hospital stays is based on the benefit period. Here's where it can get a bit tricky. A benefit period is the way Medicare measures how much you've used your covered hospital services. It starts the day you're admitted to a hospital as an inpatient, and ends when you haven't received inpatient hospital care or skilled nursing care for 60 consecutive days. You could have multiple benefit periods in 1 year, depending on how often you're admitted to the hospital. After your deductible is paid, you will not have any other costs for room and board during your hospital stay for up to 60 days. However, if your hospital stay extends beyond 60 days, you will be responsible for a copay each day. If you're admitted to a skilled nursing facility, the first 20 days are covered in full by Medicare. After 20 days, you're responsible for a copay each day up to 100 days. So, how does this impact your life? Well, let's say you are admitted to the hospital for an emergency that requires a 3-day stay. You'll be responsible for paying the deductible. After that, Medicare Part A covers the rest of your room and board costs for the first 60 days. But remember, if your hospital stay extends beyond 60 days, you'll be responsible for paying the daily copay. Overall, understanding Medicare Part A costs is essential when approaching retirement age. By having a basic understanding of benefit periods, co-pays, and deductibles, you can make informed decisions about your healthcare coverage and prepare financially for potential healthcare expenses. Medicare Part B covers medically necessary services, like doctors, labs, tests, durable medical supplies, and more. It's important to understand the costs associated with it. First, let's talk about monthly premiums. Most people who enroll in Medicare Part B will pay a monthly premium. It may be higher for people with higher incomes. You'll pay this premium monthly for as long as you're enrolled in Part B. Next, let's talk about co-pays and deductibles. These are costs you might have to pay when you receive certain medical services or supplies. The amount you pay will depend on the service or supply you receive, but here are some examples. Doctor visits. You'll typically pay 20% of the Medicare-approved amount for the visit, after you meet your yearly deductible. Lab tests. You'll pay nothing for most lab tests if the lab accepts Medicare assignment, meaning they agree to accept the Medicare-approved amount as full payment. If the lab doesn't accept assignment, you may have to pay 20% of the Medicare-approved amount. Durable medical equipment like wheelchairs or walkers, you'll typically pay 20% of the Medicare-approved amount. Some services, like preventative screenings such as mammograms or flu shots, don't require a copay or deductible. There are also other costs you might encounter with Medicare Part B, such as excess charges. Some doctors or other healthcare providers may choose to charge more than the Medicare-approved amount for a particular service. If this happens, you'll have to pay the excess charge out of pocket up to 15% more than the Medicare-approved amount. So, how do these costs impact individuals with different healthcare needs and financial situations? Generally, people with more healthcare needs who see doctors regularly, need ongoing medical supplies, etc. will end up paying more out of pocket than people with less healthcare needs. However, because the monthly premium is the same for everyone regardless of healthcare needs, people with lower incomes may find it more difficult to afford Part B overall. One thing to keep in mind is there are programs available to help lower-income individuals cover their Part B costs. For example, Medicaid can help cover premiums and co-pays, and the Medicare savings programs can help with premiums and deductibles. In summary, there are various costs associated with Medicare Part B, including monthly premiums, co-pays, deductibles, and excess charges. These costs can vary based on the service or supply, and they can impact individuals differently based on their healthcare needs and financial situations. It's important to understand these costs and explore any assistance programs that might be available to help cover them. Medicare Advantage, Part C, combine Parts A, B, and sometimes D into one plan. The costs vary depending on the plan you choose, but you'll generally pay a monthly premium, in addition to co-pays and deductibles. Although most companies offer plans with a $0 premium, we will discuss Medicare Advantage plans in another chapter. Medicare Part D is a Medicare program that provides prescription drug coverage to Medicare beneficiaries. The costs vary, but you'll generally pay a monthly premium and have co-pays. The program was introduced in 2006 to provide affordable and accessible medication coverage to seniors and people with disabilities. Medicare beneficiaries can enroll in a standalone prescription drug plan or a Medicare Advantage plan that includes prescription drug coverage. These plans are offered by private insurance companies. Medicare Part D plans are divided into tiers, which determine the cost of a medication. Tier 1 drugs are the least expensive and include preferred generic drugs. Tier 2 drugs are slightly more expensive and include non-preferred generic drugs. Tier 3 is for preferred brand name drugs. Tier 4 drugs are non-preferred drugs, and Tier 5 specialty drugs are typically the most expensive. Some formularies also include Tier 6, which are commonly used inexpensive drugs. Formularies are lists of prescription drugs that are covered by a specific Medicare Part D plan. Each plan's formulary includes drugs that are organized into tiers based on their cost. Formularies must include every type of drug, but not every brand. Most Medicare Part D plans have a deductible, which is the amount that a beneficiary must pay before the plan begins to pay for their prescription drugs. However, some plans may offer a $0 deductible for Tiers 1 or 2. After the deductible is met, beneficiaries are responsible for co-pays. These are fixed dollar amounts that a beneficiary pays for each medication. The copay amount varies based on the tier of the medication. Some plans may also have coinsurance, which is a percentage of the drug price. For example, a Tier 1 medication may have a $5 copay, while a Tier 3 medication may have a $50 copay. Co-pay amounts vary by plan. The coverage gap, also known as the donut hole, is a temporary period during which beneficiaries pay more for their prescription drugs. During the coverage gap, beneficiaries pay 25% of the cost of their medications. Once a beneficiary has spent a certain amount out of pocket on covered drugs, they reach the catastrophic coverage phase, which is after the coverage gap. At this point, beneficiaries pay a small co-pay or coinsurance amount for their medications. Catastrophic coverage lasts for the rest of the year and offers significant savings for beneficiaries who need expensive prescription drugs. Part D plans include cost-saving measures like step therapy for certain medications. Step therapy requires beneficiaries to try lower-cost drugs before they can access more expensive medications. Step therapy can save money for both beneficiaries and the Medicare program. Some medications may have a prior authorization clause or quantity limits. Prior authorization means the prescription must be approved by the company before it is dispensed. Additionally, Medicare Part D plans may offer cost-saving measures such as mail-order pharmacy services or preferred pharmacy networks. These options can offer savings on copays and provide greater convenience and access to medications. Medicare Part D offers significant benefits to seniors and people with disabilities who need prescription drug coverage. The program can provide access to critical medications and offer significant savings on out-of-pocket costs. However, the program may have drawbacks for some beneficiaries. For example, some Medicare Part D plans have high deductibles, copays, and premiums. Beneficiaries must carefully compare plans to find one that meets their needs and budget. Additionally, some beneficiaries may face coverage gaps or high out-of-pocket costs for expensive medications. You should carefully review the plan's coverage before enrolling to ensure it meets your unique medication needs. In conclusion, Medicare Part D is an essential program that provides prescription drug coverage to seniors and people with disabilities. The program offers a range of tiers and formularies that can help beneficiaries access and afford their medications. Beneficiaries should carefully compare plans and consider cost-saving measures to ensure that they choose a plan that meets their needs and budget. Chapter 2. Main point. IEP Initial Enrollment Period. There is a 7-month window to enroll during the initial enrollment period, 3 months before your birthday month, and 3 months after your birthday. GEP General Election Period is January 1st through March 31st, and coverage will begin the first of the month following enrollment. There are penalties for Part B and D if you don't enroll when first eligible unless you have credible coverage. Bonus tip. To enroll, contact the Social Security Administration at www.ssa.gov or call 800-772-1213 or visit a local office. Now that Sarah understands the parts of Medicare better, she wants to get a handle on how and when to enroll. One of her friends ended up being penalized for not enrolling on time. Sarah definitely wants to avoid that. What is the initial enrollment period? The initial enrollment period IEP is the first opportunity you have to enroll in Medicare. It lasts for 7 months, beginning 3 months before you turn 65, including the month of your 65th birthday, and ending 3 months after your birthday. If you don't enroll during this time, you may face penalties or delays in receiving coverage. Why is timely enrollment so important? Enrolling in Medicare during your IEP is critical because it ensures that your healthcare needs are covered. As you age, your healthcare needs may increase, and having adequate coverage can be the difference between getting the care you need and facing financial hardship. Medicare offers a range of benefits, including hospital insurance Part A, medical insurance Part B, prescription drug coverage Part D, and Medicare Advantage Part C. By enrolling on time, you can avoid delays in receiving coverage and costly penalties. What happens if I miss the deadline? If you miss your IEP and don't have other coverage, you may have to wait until the next enrollment period, which could cause a delay in receiving healthcare services. The general election is from January 1st to March 31st of each year. Your coverage begins the beginning of the next month after enrollment. Additionally, you may face a penalty for signing up late, which is 10 of the monthly premium for every 12 months you were eligible but didn't enroll. There is also a Part D penalty. The penalty is 1 for every month you didn't have credible coverage but were eligible. This amount is added on to your Part D prescription drug premium. This penalty is a forever penalty, unlike the Part B penalty, which may go away after time. How do I enroll in Medicare? You can enroll in Medicare online, by phone, or in person. To enroll online, visit the Social Security Administration website, www.ssa.gov, and follow the instructions for creating an account. Once you have an account, you can begin the enrollment process. To enroll by phone, call the Social Security Administration at 1-800-772-1213. If you prefer to enroll in person, visit your local Social Security office. Automatic enrollments. If you are disabled, you will be automatically enrolled in Medicare on your 25th month of being disabled. Once you are enrolled in Medicare Part B, you will have 90 days to make a coverage selection. People that are already receiving Social Security benefits will be automatically enrolled in Medicare 90 days before their 65th birthday. If you do not receive your Medicare card in the mail within 45 days of your birthday, you should contact the Social Security Administration. Delayed enrollments. You can delay enrollment in Medicare if you currently have credible coverage from an employer. Credible coverage is coverage just as good as Medicare. Before you decide, speak with your benefits administrator to understand your options. Some employers may still want you to enroll in Medicare, some won't. You won't know until you ask. Enrolling in Medicare during your IEP is critical to ensure that your healthcare needs are covered. By understanding your options and deadlines, you can avoid penalties and delays in receiving coverage. Many seniors have discovered the value of timely enrollment in Medicare. Here are a few of their stories. Mary turned 65 and decided to delay enrolling in Medicare because she was still working and had employer-sponsored coverage. When she retired a few years later, she realized that she had missed her IEP and thought she would face penalties. She was relieved to find out that since she had credible coverage, she would not have any penalties. Rita enrolled and was able to find the coverage she needed. Next, Susan was confused about the enrollment process and didn't realize that she needed to sign up for Part D separately from Original Medicare. She missed the deadline for Part D and faced a penalty when she finally enrolled. She learned the hard way that it's important to understand all of your coverage options and deadline requirements. Finally, there's Mike, who thought he could wait to enroll in Medicare until he turned 65. He had coverage through his wife's employer but neglected to sign up for Medicare when they retired and moved out of the area. As a result, he faced penalties. He now understands the importance of being aware of the enrollment periods and deadlines for Medicare. These stories demonstrate that it's essential to thoroughly understand your coverage options when you become eligible for Medicare. You don't want to miss important benefits or end up with costly penalties down the line. Being informed and proactive can save you a lot of headaches in the future. Chapter 3. Main point. Medicare Advantage is an all-in-one plan, sometimes called Part C, which equals Part A, plus Part B, plus Part D. Extra benefits include dental, vision, gym, and more. There is a maximum out-of-pocket, and also a network of providers. This plan is for risk takers because you don't know what your medical expenses will be. Think of it as a pay-as-you-go. When you use it, you will have to pay co-pays for most services. Medicare Supplement. Build your own coverage. Original Medicare plus Medicare Supplement Plan plus Part D supplements only covers what Original Medicare covers, although some companies make provisions for other benefits. Supplements are accepted wherever Original Medicare is accepted because there are no networks. This plan is for people who are risk-adverse. You will pay upfront via your premium, then you will have predictable costs. Bonus tip. The best time to get a Medicare supplement plan is when you are first eligible for Medicare. There is no medical underwriting at that time. Choices. Medicare Advantage versus Supplement. Next, the counselor explains some of the different options for Medicare coverage, including Medicare Advantage and Medicare Supplement plans. With the counselor's help, Sarah was able to evaluate the different options and choose a plan that fit her needs and budget. The next step is to evaluate your healthcare needs. Do you have any chronic conditions that require ongoing treatment? Are you happy with your current doctor or specialist? Do you have any prescription medications? What are your priorities when it comes to healthcare? By answering these questions, you'll have a better idea of the type of coverage that works best for you. When it comes to Medicare, there are two main types of plans, Medicare Advantage and Medicare Supplement. Each has its own benefits and drawbacks, making it important to understand the differences so you can choose the plan that's right for you. We'll explain the key differences between Medicare Advantage and Medicare Supplement plans, and help you determine which one is the best fit for your individual needs. I like to call them the difference between pay-as-you-go and pay-up-front. Medicare Advantage is more of a pay-as-you-go plan. Each time you use it, in general, you will have a co-pay unless otherwise noted by the plan. This plan is for people that are more risk-takers. You won't know what your costs will be because it will be dependent upon your health. Medicare Supplement is more pay up front. Once you make your premium payments, you will not have a lot of out-of-pocket expenses, and if you do, they will be predictable. These plans are for people who are more risk-adverse. What is Medicare Advantage? Medicare Advantage plans are offered by private insurance companies that contract with Medicare to provide your Part A hospital insurance and Part B medical insurance benefits. Medicare Advantage plans offer coverage that is at least as good as original Medicare, but may also include additional benefits like vision, dental, and hearing. Many Medicare Advantage plans also offer prescription drug coverage, Part D. Medicare Advantage networks. There are many network types for Medicare Advantage plans, although in this guide we will only discuss the three most popular HMO, PPO, and HMOPOS. An HMO is a health maintenance organization and generally requires you to use doctors, hospitals, labs, and other healthcare providers that are in the plan's network. In most cases, if you get services from an out-of-network provider, Medicare won't pay for those services. A PPO is a preferred provider organization and allows more flexibility than an HMO. Generally, with a PPO, you can receive services from out-of-network providers but may have to pay more in co-pays or co-insurance when using out-of-network providers. Finally, an HMOPOS or Health Maintenance Organization point of service is a combination of an HMO and PPO. With an HMOPOS, you can get care from both in-network and out-of-network providers, but will pay less for in-network services. As with a PPO, if you go to an out-of-network provider, you may have to pay more co-insurance or co-pays. Additionally, you may have to get referrals from your primary care physician before you can see a specialist. Benefits of Medicare Advantage. Medicare Advantage plans offer additional protection and peace of mind with the added coverage they provide. Medicare Advantage plans often have lower out-of-pocket costs than original Medicare, including co-pays for doctor visits and hospital stays. Additionally, there may be no-cost or low-cost preventive care benefits to keep you healthy. Plans also have a set limit on the amount you'll have to pay out of pocket each year. Another benefit is that many plans include additional benefits like vision, dental, and hearing. This can be very helpful for individuals who need these services but can't afford them otherwise. Drawbacks of Medicare Advantage. One of the main drawbacks of Medicare Advantage is that you may be restricted to seeing doctors that are in the plan's network. This can be an issue for individuals who travel frequently or have a favorite doctor that is outside of the network. Another potential drawback is that some plans may have restrictions on which brand name prescription drugs are covered. It's important to carefully review any Medicare Advantage plan you're considering to make sure it meets your needs. What is Medicare Supplement? Medicare Supplement plans, also known as Medigap, help cover the gaps in original Medicare coverage, such as deductibles, copayments, and coinsurance. Medicare Supplement plans are sold by private insurance companies and are designed to work in conjunction with original Medicare. Benefits of Medicare Supplement. One of the main benefits of Medicare Supplement is that it can help you pay for the expenses that are not covered by original Medicare, which doesn't have an out-of-pocket maximum. This can help you avoid unexpected medical bills and provide peace of mind. Another benefit is that you can visit any doctor or hospital that accepts Medicare, so you don't have to worry about being restricted to a network. Drawbacks of Medicare Supplement. One of the main drawbacks of Medicare Supplement is that it may have a higher monthly premium than Medicare Advantage. Additionally, Medicare Supplement does not typically offer any additional benefits beyond what is covered by Original Medicare. Although some companies may offer more benefits through a discount or an additional premium. This means that you may still need to pay out of pocket for things like dental, vision, and hearing. Which one is right for you? When deciding between Medicare Advantage and Medicare Supplement, it's important to consider your individual needs and preferences. If you are someone who travels frequently or has a favorite doctor that is outside of the network, Medicare Supplement may be the better option for you. However, if you need additional benefits like dental, vision, or hearing, or you are on a tight budget, Medicare Advantage may be the better choice. When comparing plans, it's important to carefully review the costs, coverage, and potential limitations of each plan type to determine which one is right for you. You may also want to talk to a licensed insurance agent who can help you navigate the complex world of Medicare and find the plan that's right for your individual needs. Real-life examples. John is a retired teacher who needs a hip replacement surgery. Because he travels frequently with his wife, he chooses a Medicare Supplement plan so he can visit any doctor or hospital that accepts Medicare, regardless of their location. Linda is a retiree on a fixed income who needs regular dental and vision care. She chooses a Medicare Advantage plan that includes dental and vision benefits to help save on out-of-pocket costs. Choosing between Medicare Advantage and Medicare Supplement plans can be a difficult decision, but understanding the differences between the two can help you make an informed choice. Note, Medicare typically doesn't pay for services if they don't consider them medically necessary. That means, no matter which type of plan or network provider you choose, Medicare won't cover the cost of services that it considers unnecessary. If you're unsure whether certain services are covered under Medicare, you can always check with your insurance provider or visit the Medicare website for more information. Whether you choose Medicare Advantage or Medicare Supplement, it's important to carefully review any plan you're considering to ensure it meets your individual needs and preferences. With the right plan, you can get the coverage you need to stay healthy and happy in your retirement years. Chapter 4. Main point. Special needs plans are designed for specific groups. They are Medicare Advantage plans and include additional benefits. Chronic Special Need (CSNP). You must be diagnosed with diabetes, heart failure, chronic obstructive pulmonary disease (COPD), and end-stage renal disease (ESRD). Dual eligible DSNP. You must have Medicare and Medicaid. Your Medicaid must be at a certain level for most plans. Bonus tip. If you are eligible, it will definitely be worth your while to see if there is a plan that works for you. These plans give you 4 opportunities to enroll each year. Special needs plans. Medicare provides a wide variety of special needs plans (SNPs) for individuals with specialized healthcare needs. These plans are designed to provide targeted coverage and care for people who meet specific criteria. Let's take a closer look at 2 types of SNPs, Chronic Special Needs Plans (SNPs) and Dual Eligible Special Needs Plans (SNPs). We'll explain what each plan entails, who is eligible to enroll in them, and how to enroll. We'll also feature real-life testimonials from individuals who have benefited from these plans. What are Chronic Special Needs Plans (SNPs)? Chronic Special Needs Plans (SNPs) are designed to provide targeted coverage and care for individuals living with long-term or chronic illnesses. These plans provide additional benefits and services that address the specific needs of people living with these conditions. Some of the chronic illnesses covered by SNPs include diabetes, heart failure, chronic obstructive pulmonary disease (COPD), and end-stage renal disease (ESRD). Eligibility for SNPs. To be eligible for a SNP, a person must have been diagnosed with at least one chronic illness. They must be enrolled in Medicare Part A and Part B and live in the service area. Enrollment in a SNP plan is also subject to the plan's individual eligibility requirements. Benefits of SNPs. C-SNPs provide a variety of benefits and services tailored to the specific needs of individuals living with chronic illnesses. These benefits can include prescription drug coverage, coordinated care between healthcare providers, specialized medical equipment, and transportation to medical appointments. Testimonial. I have type 2 diabetes and was struggling to keep up with the cost of my medications and medical equipment. I enrolled in a C-SNP and was pleased to find that it not only covered all of my medications, but also provided me with a nutritionist and transportation to and from my appointments. It's been a lifesaver for me. Elizabeth L., Austin, Texas. Enrolling in a C-SNP. To enroll in a C-SNP, you must first confirm that you meet the plan's eligibility requirements. Once you've found a plan that meets your needs and eligibility requirements, you have 4 opportunities to enroll each year. During the annual enrollment period, October 15th through December 7th, or during a special enrollment period, which happens every quarter, January through September. What are dual eligible special needs plans D-SNPs? Dual eligible special needs plans D-SNPs are designed to provide targeted coverage and care for individuals who are enrolled in Medicare and also have Medicaid. These plans provide additional benefits and services that address the specific healthcare needs of individuals with limited income and resources. Eligibility for D-SNPs. To be eligible for a D-SNP, a person must be enrolled in Medicare Part A and Part B, and have the correct Medicaid level, along with living in the service area. Benefits of D-SNPs. D-SNPs provide a variety of benefits and services tailored to the specific needs of individuals with limited income and resources. These benefits can include prescription drug coverage, coordinated care between healthcare providers, dental and vision care, and transportation to medical appointments. Testimonial. I was struggling to make ends meet on a limited income and had to choose between paying for my medical expenses and paying for food or rent. A friend told me about D-SNPs and how they could help me. I enrolled and was amazed at the coverage and services that were available to me, including transportation to my medical appointments and dental care. It's been such a relief and has made a huge difference in my life. John R., Los Angeles, California. Enrolling in a D-SNP. To enroll in a D-SNP, your eligibility must be checked. Once eligibility is confirmed, you can search for available D-SNP plans in your area. Once you've found a plan that meets your needs and eligibility requirements, you have 4 opportunities to enroll each year. During the annual enrollment period, October 15th through December 7th, or during a special enrollment period, which happens every quarter, January through September. Chronic Special Needs Plans C-SNPs and Dual Eligible Special Needs Plans D-SNPs are designed to provide targeted coverage and care for individuals with specific healthcare needs. These plans provide additional benefits and services that address the specific needs of these individuals, including prescription drug coverage, coordinated care between healthcare providers, and transportation to medical appointments. If you're eligible for either of these plans, it's important to take advantage of the benefits and services available to you. Chapter 5. Bonus tip. Check the Better Business Bureau and Google for reviews of a company or agent. Final thoughts. Schedule your free consultation. You don't have to do everything yourself. It's okay to ask for help. There are hundreds of decisions you need to make and almost as many options. You can go it alone with the information in this booklet, or you can have someone walk through the process with you. You can spend countless hours trying to figure out all that you need to understand, or you can have the process completed in a few hours, depending on the number of questions you have. We at Lifestyle Safety are here to make the process easy. You deserve a specialized consultation that considers your preferences, situation, and budget. The best part is our service is no fee to you. We work with all major carriers. We are also highly rated. Check out our reviews on Google and the Better Business Bureau. Our customers love us. Listen to a few. Been using Janine Davis for 7 years now. She has just processed my Medicare. She has always walked me through everything in detail and answered questions right away. I would recommend her to anyone coming up on Medicare. Awesome lady. E. Phelps. Here's another. I recently signed up for Medicare with the help of my agent Janine Davis. Janine is personable, very competent, and professional. She walked me through the process and took as much time as I needed. I never felt rushed or that any of my questions weren't applicable. J. Keys. What to bring to your consultation. A list of prescriptions, including the name, dosage, how many times per day, and whether it is brand or generic. The name of the hospital system you prefer, and a list of doctors, including their name, city, and their specialty. What next? Review your plan annually. Once you enroll in Medicare, it's important to review your plan each year during the annual enrollment period AEP from October 15th to December 7th. During this time, you can make changes to your plan, such as switching from original Medicare to a Medicare Advantage, switching Medicare Advantage plans, or changing your prescription drug coverage. Even if you're happy with your current plan, it's still a good idea to review it annually to make sure it still meets your healthcare needs and budget. Stay informed. Finally, it's important to stay informed about changes to Medicare and how they may impact your coverage. Sign up for Medicare's free Medicare and You Handbook. By staying informed, you can make informed decisions that empower you to take charge of your health and well-being. Remember, with a growth mindset and a commitment to learning, you can navigate the Medicare enrollment process with confidence and an open mind. We at Lifestyle Safety are here to help. We will be with you through the enrollment process and beyond. If we are your agent of record, we can help all throughout the year. Contact us anytime. About the author. I am passionate about helping people. I believe this passion comes from experiencing life's challenges and allowing God to help me overcome. I have both a ministry and an insurance background. I am married to my handsome husband Richard. We are raising our granddaughter Elise in my hometown of Detroit, Michigan. Richard, Elise, and Milo our dog keep life busy and interesting. I have a Bachelor of Arts in Mathematics from Wayne State University and a Master of Theology with an emphasis in Christian education from Dallas Theological Seminary. I have over 30 years of ministry experience, including planting a church called the Bridge Covenant Church and over 20 years of insurance experience. I am also the owner of Lifestyle Safety LLC, which specializes in insurance and mortgage solutions.